Please.
Yes, pray. Dear Heavenly Father, again we come to you tonight thanking you for your blessings and asking for your leadership tonight, Lord. We ask you to grant us the wisdom and discernment to make good decisions when dealing with the business of the county. Lord, we pray for our communities, our county, our state, our nation. We lift those up to you, Lord, in our community and county that are sick and those who have lost loved ones recently, Lord. We lift them up for your healing and your strength. These things I ask in Jesus' name. Amen.
Amen. Thank you. We now call to order the Swain County Commissioners' regular session for December the 10th, 2020. Having called the meeting to order, we will ask our leader of the pledge to come forward, please.
Takes the colors. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, sir. For any who are looking on, I want to personally thank Gunnar and his wife Amy for the flowers that you see in front of you. Some of us who are tough don't want them sitting beside us, so they put them down so you can't see them, but we do thank you very much, Gunnar. Thank you, and thank Amy for us.
Thank you.
Hey, Merry Christmas.
Merry Christmas.
Same to you. Do we have anything on the agenda that needs to be changed? Then we'll move down to section 3 of the agenda, administrative reports and budget amendment, and we will begin with the tax collector's report.
Good evening. This is for the month of November 2020. Total receivable $5,760,709.89. Tax lien cost and interest penalties. The ad valorem collects year-to-date $889,430.25. I'm sorry, that's for the month. $889,430.25. Year-to-date $3,094,528.88. Delinquents, write-offs, cashbacks, refunds, total monthly collected, $1,027,274.45. Collected year-to-date, $4,364,923.20. The vehicle for the month is $33,439.32. Year-to-date, $182,858.31. Waste fee collected for the month, $110,555.48. Collected year-to-date, $437,567.78.
Any questions? We have the October report with us as well, and that's the one that had to be correct, or some of the numbers had to be correct.
Yes, sir.
Okay. If there are no questions, and I hear none, I will ask for a motion to accept this report as given, and if I can have a motion, please.
I'll make that motion.
We have a motion on the floor to accept the tax collector's report for 2020, November. I need a second.
A second.
We have a motion and a second on the floor to accept this report as given. And all of those in favor, please raise your right hand. Carried unanimously. Thank you, Katie. The finance report, is that you? Okay.
I'll go back just a second to the tax report. For the month of November and October, if you look at the total collected year to date, and then if you do the addition numbers, it's going to be off about 300,000. Peggy and I talked about it, and basically what it is, it's the difference between her scroll number and the finance, inside the finance report or inside the financial statement on the general ledger. We've had a lot of auditing entries throughout this last 6 months. And so that's going to be the discrepancy. That's why it's not, if you do the addition and add up all those numbers, they're not going to be exactly right. And that's what last month when I mentioned it to you,
Right.
that's what I was seeing there.
Okay.
In October, just FYI,
Right.
I think it is straight, that's how we've always done it. I think just in this 6-month time period until the audit's over with, you're going to see that discrepancy a little bit. So anyway, should straighten out by the end of the year.
Okay.
With that said, for the finance report for the month of November, total revenue for the month, $2,102,336.98. Revenues, $9,389,218.61. Year-to-date, we've received 63.01%. Expenses for the month, $1,505,409.30. Expenditures year-to-date, $9,345,895.11. Year-to-date, we've paid out 63.19%. Current year surplus of $43,323.50. I just do want to for you to pay attention to that number as well. As you know, it's kind of a lot down from last year. We have not, up to this point, requested any of the settlement money, which is the 1.3 that y'all had budgeted, nor have we received any of the allocation for November for the critical needs school application. So we're about 500,000 off of net. So that would bring it to about 1.9 million, which is definitely bigger than in November of 2018. We did have a lot more money coming in last year because of different things with like financing of cars, which is 800,000. So if you take all that in consideration, we're pretty much definitely doing good financially in the general fund itself. Solid waste fund, total revenues year to date, $508,073.08. Expenditure year to date, $577,137.98. A deficit of $69,064.90. Social service fund, revenues year to date, $920,067.45. Expenditure year to date, $1,570,754.72. And that is a deficit of $650,687.27. Health Department fund, year to date, $484,000, revenues year to date, $484,845.76. Expenditure year to date, $649,158.01. And that's a deficit of $164,312.25.
Any questions? Hearing none, I will ask for a motion to accept this report as given.
I make that motion, Mr. Chairman.
Support it again.
Second, or whatever.
We have a motion and a second on the floor to accept this report as given. Any questions? Hearing none, all of those who approve, raise your right hand. And we're carried unanimously. Budget amendment, which is in your book and was in your packets. Mr. Manager, do you want to address that, please?
Yes. So back in September, we talked about the pool project, and it's kind of taken us this long to get going on that. And so basically, we've had to rebid it twice. We're still waiting on complete authorization from the state as far as the environmental part, but I think we're really close. And so we did ask for bids several weeks ago, and I did get a couple. And one of them meets this parameter here. A lot of that 450,000, or at least 50,000 of it, is like a contingency fund, just in case the unforeseen happens. We will be utilizing some of the staff at the maintenance department to help with some of those demolition activities. So it is gone over, the initial thing back in September was 400,000. We're just estimating, this is a budget, we're hopefully gonna be close to 400,000, but we need a little contingency in there, so that's the 50,000. So for a total TDA funding, 50,000 contingency, which is already put in the budget under contingency and special appropriations, we're taking from that 300,000. The restricted fund balance, so at the end of each year, there's different fund balance sections in the audit, and one of them is undesignated, which just means it's in your savings account. You can do whatever you want to with it. But then we designate certain ones, like if we get a grant or if it has to be spent on a specific project, it's put in what they call restricted fund balance. So this NHF is Nantahala Health Foundation, $100,000, and that is a grant, and it was put in restricted fund balance. So that's why you have to do it like that. But anyway, for a total of 450,000, like I say, I don't anticipate or hope we're not going to go that high. But with contingency, they don't know kind of when they get in there what's underneath a 44-year-old pool either. So it's kind of one of those variables that they actually ask us to set aside 8% of the total amount to go toward contingency. And so that's kind of what that is. So.
Any questions? Swain County Budget Amendment number 4 for $450,000 has just been explained. Anyone have any questions? Hearing none, I will accept a motion to accept this report, this amendment.
I'll make that motion.
We have a motion on the floor to accept the amendment, budget amendment number 4. Do I have a second?
I'll second.
We have a motion and a second on the floor to accept the budget amendment number 4. All those in favor, please raise your right hand. Carried unanimously. I hope the manager went out to see if anybody wanted to speak and not just left us. So.
He's done.
Okay. Okay, on the public comments, we have no one signed up for that. So we'll move on down the agenda. Action items, the minutes, November the 12th, regular session. Okay, that was my fault. I said we had 2. I thought I had 2, but I don't. So having looked at the minutes from November the 12th regular session, we did gather for a couple of other things, but that was the welcoming back the commissioners who had faced an election. We appreciate them coming back. So the November the 12th minutes are in your packet. Any additions, corrections, or subtractions from those minutes? Hearing none, I will entertain a motion that we approve those minutes as given.
I make the motion, we approve the minutes as given.
We have a motion on the floor to approve the minutes of November the 12th, the regular session, as given. I need a second.
Second.
So we have a motion and a second on the floor to accept the November 12th regular session minutes. All in favor, raise your right hand, please. Passed unanimously. 2020 State of the County Health Report. There she is.
You didn't think I missed this, did you?
Rounded the corner on 2 wheels. I love that.
I thought the finance report was, you guys must have done it when I wasn't listening. I'm sorry about that.
That's all right.
Good evening, gentlemen. Thank you so much for your time. It's been a little while, huh?
It is.
So, I hope you're all having a good holiday season so far under these times.
And you, and your
Yes.
family.
Absolutely. So I'm bringing you the SOCH, State of the County Health Report 2020. So this is our last report for the 2018 CHA process, the Community Health Assessment process. That's that 3-year process. We kind of go over that every year. But I sent all that a little bit ahead of time just to speed things up tonight with our capacity in the room. So just a reminder, the SOCH is just the report to show you the current information on the health status of the county related to the illness, deaths, high-risk behaviors for the particular year, so 2020, just kind of synopsis of everything. Also to remind you that it's just a snapshot of the progress that we've made with the priorities chosen through that whole community health assessment process that you guys were involved in. It's definitely not an all-encompassing report of all the good things being done in our community with other organizations as well as the health department and nonprofits. So I didn't get any questions. I sent this to you on December 1st to give you time to kind of refresh your memory on how to use the system. We've been digital now since 2017. And with no questions, I just wanted to make sure that you guys didn't have any questions or any input on this particular report.
I thought your little video was helpful.
The how-to video, hopefully that was better for you, yes. You also got a video of the update for Swain Summit.
Summits.
A little bit more fun to watch than, than the STOTS report. So we really had a huge success with that. And I think that given the fact during that we're, through this pandemic, we were able to actually still bring people back that wanted to participate this next year. So I was really pleased with that. So hopefully you guys were as well. Okay, so before you decide if you're approving the report or not, I just want to just kind of give you guys a quick synopsis of what's going to happen next. So 2021 is our next community health assessment year. So next week is our kind of launch of choosing out. If you remember, we're going to be collecting data next spring and summer from the community, hitting those different socioeconomics with 75 questions. We don't do this. We actually, WNC Healthy Impact does this for us, but we get to choose 3 county-specific questions. So next week, you're going to be getting an email so that you can tell us, the Community Wellness Action Team, which of those questions that we give you do you think we should be asking. So I'm just asking you, if you do nothing else, to please respond to that email, not just as leaders for our community and giving input to that community health assessment starting next year, but for the health department's accreditation. We need to show that you guys are involved in this whole process next year. Okay, so that is it. That is all I have for you today.
I will entertain a motion to accept this report as given.
I'll make that motion.
And we have a motion on the floor to accept the report as given from Trish. I need a second, please.
Second.
We have a motion and a second on the floor to accept this report from our public health educator. All those in favor, please raise your right hand. Carried unanimously.
Great, thank you guys. Happy
Thank you.
holidays.
Thank you.
Happy holidays to you as well. Thank you. Swain County Health Department updates.
Good evening. I handed out the COVID report. It wasn't on the agenda, but I thought I would update you on that as well since it's been a month. For Swain County, total test 8,917, positive 485 since March, active cases 49. Again, fatality is 5. Our overall positivity rate since March is 5.4%. Our case fatality is 1%. We do get questions a lot about why we do not do a daily positivity rate or a 2-week time frame. And the reason we do not do that is we do not receive all of the negative results from all of our testing site, so the data would be skewed wrongly for that. But this is the best that we can do with the information that's given to us from the testing sites. On the back page, again, is the breakdown from Western North Carolina, some of the counties. Looking across the board, the overall positivity rate is staying about the same in all of the counties. Luckily, the case fatality rate is dropping in all of the counties as well. Just to point out, Graham County has 28 active cases. Macon, as of yesterday, had 92. Clay County, as of yesterday, had 21. Cherokee County, as of yesterday, had 89. Jackson, as of yesterday, had 194. On the bottom page is the new graph that we are uploading on Facebook on Mondays and Thursdays. It just gives all the information. It's a little easier to look at and to read with our cases in Swain County. Do you have any questions on that?
Yes,
Yes.
do you have any, I know in the state it shows hospitalizations, but do we have people,
We do. We have 5 currently that we are aware of that is in the hospital.
are they away from here, or are they in our hospital? I mean, do we have plenty of room still in our hospital?
We still have capacity at our hospital.
Because I know with 5 people in our hospital, that's,
Well, it's 5 people in our county that are hospitalized.
Right.
Could be in the Silva Hospital or Mission or various places.
what I was saying, if all 5 were here, we'd be at pretty much capacity.
We would, yes. But all the COVID cases would be sent to Jackson County first, their hospital. And then if there was overflow, then I would assume possibly Mission, Haywood, and then just depending here what capacity they have at our hospital.
What is the capacity of our hospital?
I honestly do not know. I'm sorry. They gave an update before, but I don't remember what they said. Do you? Update on the vaccine. We're in daily and hourly webinars now about the vaccine. We have the Pfizer vaccine and Moderna vaccine. The Pfizer vaccine is the one, the cold storage. That will be shipped to various hospitals theoretically next week. Those were hospitals that were pre-identified for having that cold storage. Haywood and Mission both have that and should be receiving that vaccine next week. After that, the second week, which is the week of Christmas, health departments should be receiving vaccine as well as other hospitals and long-term care facilities at that point. I do not know which vaccine we will receive or how much or exactly when it will ship. But theoretically, it should be the week of Christmas. Once we receive it, our plan is to vaccinate those with emergency management, healthcare workers, dentists, people of that nature first. And then when the state says we can move on to 1B, then that's what we'll do if we have any vaccine left. At this time, both the hospital and I know Mountain View Manor will both receive shipments, or they should receive their own shipments of vaccine. And Walgreens will be helping Mountain View Manor vaccinate those who wish to be vaccinated at the facility.
They will be vaccinated at the facility?
Yes, that is
Okay.
my understanding.
Okay, what about Bryson City?
We have had calls into them today, and we keep missing each other. So I'm not quite sure yet what their plan is. If they were on the list to be administrators for the vaccine, or if not, then we will take them vaccine. We will go out there and do that.
when does your department, when does Walgreens get the vaccine?
We should both receive the vaccine the week of Christmas.
Okay.
Theoretically.
When you say the week of Christmas,
No
that's as
clue.
close as you can get.
That's
at
close
this
I can
point?
get right now.
Okay. All right. And do you know how many you're getting, how many doses you're getting? You
No,
don't?
sir.
Is there a cost?
No cost.
Are all the vaccines a two-part?
Yes, they are.
vaccine?
Yes.
So if you get one, the first shot, you're in line then to get this
The second
3
one
weeks later or
is
something?
21 to 28 days later. And what will happen is when you get the first vaccine, you will sign up on this new app the state has created and everything like that. And it will actually contact you daily to see if you have any side effects or anything going on. And then it will also notify you when you're supposed to go back to get your second dose.
Would it be a good photo op for a county manager to get his shot with his picture being taken?
I'm sure we can
That would
line
look
some
very
people
good.
up.
Actually, I was going to ask if anyone were going to get a shot, if that would be a good photo op for you to help other people who may be trying to decide.
Yeah, what we'll probably do is see who's going to line first in phase one, the emergency management workers such as that, who's
Right.
getting vaccinated, and we'll take those, see if we can take a couple of those pictures and get some stories to put in the paper as well,
Okay.
and on Facebook.
Good. Good.
Any questions about COVID-19 or the vaccine?
Well, I was going to ask, is the testing still the same when you need to be tested? Is that the guideline still the same on that? In other words, if you feel like you've been exposed, you're having symptoms and so on, is all the guidelines on that still the same?
Yes, if you're feeling symptomatic or if you've been in a contact. The contact has changed from CDC, and North Carolina did adopt it. If you are a contact to a positive and you are not symptomatic, 5 days after that exposure, between 5 and 7 days, you can be tested. And if that test comes back negative, after day 7, you can go back to your normal life and then just monitor your symptoms for the next week. Now, of course, if you're asymptomatic, If you're symptomatic, then of course during that time period, you still need to get a test and make sure it's negative as well. But you would have to quarantine for 14 days. So if you're asymptomatic, let me go back. If you're asymptomatic and you're a close contact, you can go between day 5 and 7 and be tested. And if it's negative, you can go back to work or whatever on day 8. If you don't want to take that test, then you have to wait 10 days if you're asymptomatic, and you can go back to your life on day 11. It just used to be 14 days period. So they have shortened that for asymptomatic contacts.
I guess one more question.
Go ahead.
We seem to have had a little bit of a jump since Monday. Are you able to tell us, without revealing too much, through tracing or through, what happened there? Do we know what happened, why there tended to be a little jump there?
Most of our positives we can trace back to a previous positive. I would say there was just a handful that we cannot trace back. Most of it's family gatherings, churches. We do have an outbreak in a church. We have an outbreak at EBCI Detention Center, and then of course with our jail as well still. We're still monitoring that. But overall, everything can be linked back to families and to churches. A few work, but mostly families and churches.
Thank you.
And that just takes time. You know, some of them are sick on day 6, and some of them aren't sick until day 13, actually, so.
There is an app for your phone that's supposed to help the tracking aspect of with whom you've been in contact, et cetera. Have you looked at that? Have you seen that or tried that or?
No, I think a couple of my employees downloaded it to see how well it worked, and I can't say it was good or bad, to be honest, but it is available for you to do that.
Right.
But then, trying to determine who you are around or is it really accurate and that sort of thing, I can't say that I would use it or not.
Right. Okay, very good, thank you.
Welcome. So my other report is the actual report for the year that you have in your packet. Grants for this past year, we had a dental grant through Dr. Ridgway. It ends on December 31st. We did reapply and receive $25,000 for the next year. We also applied through them for the senior care project. It's $10,000. This was to help buy food for our in-home aid and chore programs, and that ends December 31st, and we've actually spent all that money already. So, Highlands Cashiers Health Foundation, they did a senior care project this year. It will end December 31st. We received $35,000 for 2020 to provide meals through Swain County Senior Center. We did apply through WNC Bridge Foundation. We received $7,950 to help with a MedAssist event in spring of 2021. The Great Smokies Health Foundation, we received $5,000. It provides wellness and A1C labs to those who are participating on Swain Summits program. We held the last MedAssist on October 17th. We served 878 individuals. Last year we served 803. And again, we're planning on having one in the spring that WNC Bridge Foundation has given us money for. North Carolina Health Rankings, I bring this to you every year. Last year we were ranked 87th. We're back up to 92, which is not in our favor. So we have gone on up in that. So I've given you data from 2018, 2019, 2020 about where they have ranked us. Looking at it for the most part, we're doing better overall with all the categories except length of life. We went from 91 to 98. The second page is the annual report for the health department of all of our programs. The first table is from July to June of 1819, and then the second table is July to June of 1920. With COVID, I thought our numbers would be a lot worse, but actually they're not too bad, to be quite honest, when you look down through there. Flu vaccine did surprise me. Last year we did 233. This year we only did 163. So that did surprise me just a little bit with COVID-19. At the very bottom where it says child health and it just says helmets, we gave out 90 bicycle helmets last year. This year we gave out 90 life jackets. And we plan on doing life jackets again next year for ages 0 to 18 basically. The next page is for environmental health. It has all of the inspections broken down essentially for the past 2.5 years. We do have a contract worker helping us with inspections. It just varies what she's able to do per month. She does work full-time and actually goes to school, so she helps us as much as she can. On septic, I wanted to point out that site visits, last year we did 164 site visits. This year we're already up to 136, and we're just 6 months into the year. And what site visits is when you go out to a property and you're not able to issue any permits because pits have to be dug or a property line has to be marked or various other things. So these 136 should eventually be permitted. So it just shows the growth that we've had this year. I know everybody's been talking about property sales and everything like that. This is clear data showing that. On the last page, it just goes over well permits and animal bites and complaints. Animal bites, since July, we've had 24. Last year, we had 27. So we've already had 24 into 6 months, so that's a little alarming.
Was there any indication as to why they're up? I mean, in your experience?
No. Some of them are property owners, next door neighbors. Some of them were people jogging towards Deep Creek. on the road, it's just various things.
Would it be more people are at home more often?
Possibly.
I'm sorry, what was that?
More people are at home because of the COVID stuff, so, I mean, they have been for the last while. So.
More people are at home or maybe outside in their yard. I mean, I really don't know that.
Right, right. Where would one find that particular kind of information? Is it on the reports that are given, what was going on, what was happening?
Yes and no. We ask about the circumstance, whether, of course, it would say if they're at home or if they were jogging or bicycling or this, that, and other. But there's nothing.
Would there be a time stamp on it, or?
There would be a
Time of day?
date on it, yes.
Would there be a time of day?
Sometimes if it's recorded.
It'd be interesting to see the data on if you could get the time of day it happened,
Okay.
just to see. If
We can add that to the
would be
report.
the only piece of data that would tell you anything.
You're right. Do you have that report form that needs to be filled out whenever they?
The animal bot form, we do. We have our own, and then if they do go to the emergency room or their doctor, they are required to report that to us, and we have that as well. So if they notate it, like in the emergency room, we would have that, or if they just said, we were attacked at, right when the bus got there at 3 o'clock or whatever, we would write that down. But we can adjust that form to add if they could give us an exact time or a time frame at least.
It would appear to me that we would want to know that kind of information, especially once we get into the animal control ordinance and what's going on there. We need to help people be aware of when they need to be more attentive to their pets and that kind of thing. So if you could make some kind of adjustment and pull up some information,
Okay.
or give us the form and let us take a look at it and see if we could suggest something.
Okay.
I think that would be good.
Going back to on-site and wells, on septic, we're approximately at least 8 to 10 weeks out right now. It has not slowed down at all.
Sure.
I've got a question for her about some of these two, especially since I've been going to the erosion control meetings we've been having. How many of these sites, or do I need to come and talk to you, or do I need to go see Brent about some of these sites? Because I know with the erosion control, we've been talking about house seats that our health department works real hard to help these people who's buying lots to put a septic on there. If they're buying lots that don't need, that we can't put nothing on there, do I need to talk to Brent, to talk to him about that, to see if there's lots? Because we go out of our way to help people, but some of these lots and stuff, I think some people's buying is gonna make even like the erosion control part and stuff a lot worse too, because they're buying, some of them are pretty much unusable.
With our septic laws, if I remember correctly, we cannot permit anything over 65% slope. If it's something like that, it always has to be engineered, seems like. So I would honestly, you are more than welcome to talk to Brent about that. But my inspectors would not put their name and their license on the line for anything that they did not think was in that parameter of the law.
Oh, I'm not questioning
And I understand that. And we do try to go out, somebody's got a piece of property and they're wanting to build a house on, we give them all the options they can do. And then they choose what they want to do. But if you want to talk more about it, then you're welcome to talk to Brent about that because he would be the expert on that.
Thank you.
You're welcome.
If somebody wanted to buy a lot, would the realtor be responsible for determining or helping find out all of these things about the lot and what they can build and can't build because of the space and the slope, or who has that responsibility?
Well, that's a double sword kind of thing.
Buyer
If it goes through the
Unfortunately, it's buyer
realtor,
beware at this point, because the realtor, they're gonna sell lots. They're gonna go get an IP, is it IP?
You can get an improvement permit, especially if it's the realtor's trying to sell it. Sometimes they'll go ahead and do an improvement permit that says, we've gone out to the property, it's got this type of soil. Theoretically, you could put a 3-bedroom system here, and then what happens is they go in and doze and do all this work, and we go back out there to do an authorization to construct. Sometimes it's fine, and then sometimes it's not. And we gotta
That's what
redo the
happens.
whole process,
And that's-
sometimes.
Excuse me,
Go ahead,
Ben,
no,
but- and that's part of the issue that I'm hearing. Yeah, you can go, they'll try to get pinned on, well, they sold me this, that I could have this on it. And then well, now we have to spend all this money. I mean, you can get a septic system on about anything, even if it's not underground. You can go through the state and get
Drip system, there's all kinds of systems, yeah.
all kinds of systems. But I
It
just
adds
know.
to the cost of the construction, does it not?
Yes, it does.
Yes.
Right.
And the only reason I'm even talking about this, or one reason, is because I went to a lot a year or two back that had one on it that I refused to do, but it was it was right before, the state said any permit from a long time ago.
Yes,
then
they
had the
extended those
deadline.
for years back, yes.
Right, and they put some from years back, they extended them. And there's a deadline, and people came and said, well, we've got this one, we need it in, and I told them, I said, I'm not putting that in, it's terrible. But there's people, it's buyer beware, the buyers this man didn't look at the land when he bought it. He bought it, it's in the mountains. And
Well, I
I'm
can
afraid we're gonna have more issues coming down the road,
If we-
while
if we-
I'm asking
And
with
that's,
all the,
that's my concern, is if we have issues coming down the road, we still got to deal with it.
right.
So I think that's a good question, not with what we were talking about. but
Right,
think
I
it's a
don't know
good
how
question.
I don't have even remote solution for that.
And I wanted to ask also your 8 to 10 weeks,
Yes.
what do Mr. King, is there a way that we can maybe, are we thinking it's gonna level off several months?
We've had conversations about it. I mean, we've had maybe some mapping issues that we're trying to work on now. We've got a new process for that, so hopefully that'll help a little bit. At the end of the day, with this amount of people, this amount of site visits coming in, I don't think it's gonna level off. I think it's gonna continue, and then probably next spring, we're gonna really be feeling it. That's what my take on this. So we still are looking for a full-time contract worker to help with some of this, in addition to the one that we have now. So hopefully we can work on some of that, or maybe we may need to hire another inspector.
That's where I was going with this, because now we contracted out our pools and stuff, correct?
Yes, sir.
So we'll be prepared for, that won't hurt us on our other projects. But even that, we just done that, that's just a temporary thing.
That's
too.
just a couple of months.
Right, that's all it is.
Another employee would be helpful very much to the department because they are swamped. Like I said, they're at least 8 to 10 weeks. I do not foresee this dying down or anything like that. Property is very hot right now, and it has been for over a year, probably 2 years now at least.
Yeah.
Kevin can attest to that. So I don't think we've ever been in a time where we've been less than at least 6 weeks over the past year and a half, 2 years for septic or wells. So that is something to think about, especially when you start talking about the new budget for next year or possibly before, even then.
So hiring you another inspector would be probably the ultimate answer.
Yes, it would. We would try to hire someone that was already authorized.
Right.
If not, that authorization could take at least 6 months
Well-
on just one program, because they're all different authorizations, on-site, well, inspections, schools, everything is kind of different authorization and takes time. So our goal would be to hire someone from another county.
That's a very good question, and it would be one in my mind, is if we were looking at adding a staff person, where would be the better place to place them? With inspections, or with the health department, or, you know, where would be the better place for them? So I think, I'm not asking, it's a rhetorical question, but I'm just saying that that's something that we need to definitely take a look at, and
Yeah.
everyone seems,
I think the health department, I mean, as far as road control, stuff like that, the inspection part, building inspection part, I hate to say it, but like septic systems take precedence over that to me in my mind, because you can't build a house without it. And
No, you
and if
can't, you can't pull any permits without that
Exactly.
septic.
And if you got a failing septic system, you no longer have a house. So I think it's more important to catch that on the front end.
okay, can I get us back on topic here? Interesting conversation, but let's move back. What else do you have for us?
If you want me to have Brent come at a specific time to discuss on-site or wells, if you have questions, or for the general, just let me know. We can schedule that anytime.
Okay.
But that is my
Good.
report if you have any other questions about anything else.
Yes, good, yes.
I was just going to interject one thing. So I think in June, in the springtime when we start the budget process, it might be good, because we are having conversations about health department staff, about definitely the soil erosion issue that we've got going on. But it would be good to do an analysis of between when land actually sells and when a house is permitted and built. I think that we need to look at all those functions all the way down the line. And I think that if we can bring in people from, you know, like the department heads, just to see what responsibilities they do and where we have gaps in services, I think that's going to be the best, especially for the budget process, to make sure we're addressing all of those needs, because we've had several issues, like with even plots, you know, land that, you know, they may put a septic system on a piece of property that's not even the right property, because, you know, if a homeowner gives them a plat, we need to make sure it's the correct one. So there's a lot of little pieces that we need to look at also, but I'll just interject that as well. So.
Well, and I hope you keep that in your mind, because, you know, it is something that we have to be concerned about and looked at as we're taking the steps and moving in that direction. Okay, is that it? Okay, any other around that particular?
I just have one quick
Okay.
question. Going back to the COVID thing.
Yes, sir.
With the numbers going up or anything, are there any different recommendations coming through you guys from the health department to stick with the same?
No recommendations this time. I met with the school board last night, and they've only had a couple of employees in the past week that have tested positive, and there's been a few contacts with students, but if I remember correctly, none of them have turned out to be positive from any of the contacts, just in general. So the school system's still going forward with that. And with us, like I said, most of our contacts we can connect back to a previous contact, which is good that we can connect it back. It would be worrisome if we could not connect them to a previous positive. That's where the worry would come in.
Now, the governor, excuse me, I'm going to jump in here. The governor has backed us up a little bit as far as COVID is concerned.
He enacted a curfew. It starts tomorrow at 10 p.m. or 10 p.m. From 10 to 5 a.m., you're not supposed to be out unless it's an emergency or going to work or you're a caregiver, such as that. I think it through January the 11th, possibly. Something like that.
I think it is.
So, middle of January. I'd have to look it up again.
I think it's January 11th also. Yeah.
It's something like that. But that's what he has done right now. He hasn't mentioned anything about schools or other retail businesses per se. They're supposed to close at 10 o'clock, basically. And then alcohol sales stops at 9 p.m.
Okay. I don't think, we'll wait for the governor, but I wanted that said over the airwaves so people know what's going on. So,
Okay.
thank you.
You're welcome.
Any other questions, concerns? If not, Thank you very much, and I will entertain a motion to accept the report as given to us, and I thought it was a good
I'll make a
report.
motion, Mr. Chairman, we accept the health department report.
Okay, got a motion on the floor. Do I get a second?
Second.
We have a motion and a second on the floor to accept this report as given with thanks, with our thanks. All in favor, please raise your right hand.
Thank you.
Carried
you.
unanimous. Thank you. In your book, you have the fire marshal and the commission, or their request that local firefighters on the relief fund board be reappointed. And if you have seen that, any questions on this? If not, then I will entertain a motion to reappoint, as is laid out in your letter from the Alarka Fire Department and the West Swain Fire Department. Can I have a motion?
Make a motion, Mr. Chairman.
Okay, we have a motion on the floor that the reappointments be made as recommended. And I heard one over here, so I'm just going to call that the second, if you don't mind. So we have a motion and a second on the floor. All in favor of these reappointments, please raise your right hand. And we pass that unanimously. Okay, the schedule of values for 2021 revaluation and PUB schedule. We have to do two things.
Yes. So the first document is, it says, order adopting final uniform schedule of values, standards and rules for the 2021 Swain County General Reappraisal. Whereas pursuant to General Statute 105-286, Swain County will reappraise all real property in accordance with the provisions of General Statute 105-283 and General Statute 105-317. And whereas pursuant to provisions of General Statute 105-317, the tax administrator for Swain County has submitted proposed uniform schedule of values, standards, and rules to the Swain County Board of Commissioners. And whereas the board has caused to be published in the newspaper having general circulation in Swain County a notice stating that the proposed schedule, standards, and rules have been submitted to the Board of Commissioners and indicating the time and place of the public hearing on the proposed schedule, standards, and rules. And whereas a public meeting was held at the appointed time and place, and whereas the Board of Commissioners now desires to adopt the final schedule pursuant to the provisions of General Statute 105-317. Now, therefore, it is ordered the final uniform schedule of values, standards, and rules attached to this order are hereby adopted and approved for use in appraising real property at its market value as of January the 1st, 2021. A notice of the adoptions of this order shall be published once a week for 4 consecutive weeks in a newspaper having general circulation in Swain County. The final schedule shall be available for the public inspection at the office of the tax administrator, 101 Mitchell Street, Bryson City, North Carolina. This is the 10th day of December 2020. Do you want to do them both together?
We have two of these. One is for what she just read, and the other is,
Present use value manual.
the present use value. Do you want to do those separately, Commissioners, or do you want to do them both together? It's really nothing.
She says separately, please.
Okay, then we'll do them separately. You heard the reading of the Uniform Schedule of Values for Swain County. We need to adopt this, so if you would give me a motion, that would help.
I'll make that motion.
Okay, we have a motion on the floor to adopt the first part of this. I need a second, please.
Second.
We have a motion and a second on the floor for the adoption of the appraisal, general appraisal of property in Swain County. Any questions, any concerns? If not, then if you wish to approve it, please raise your right hand. Unanimous.
The second one is the order adopting final present use value manual for the 2021 Swain County General Reappraisal. Whereas pursuant to General Statute 105-286, Swain County will reappraise all real property in accordance with the provisions of General Statute 105-283 and General Statute 105-317. And whereas pursuant to the provisions of General Statute 105-317, the tax administrator for Swain County has submitted the proposed present use value manual to the Swain County Board of Commissioners. And whereas the board has caused to be published in the newspaper having general circulation in Swain County a notice stating that the proposed present use value manual has been submitted to the Board of Commissioners and indicating the time and place of a public hearing on the proposed schedule, standards, and rules. And whereas a public meeting was held at the appointed time and place, and whereas the Board of Commissioners now desire to adopt the final manual pursuant to the provisions of General Statute 105-317. Now, therefore, it is ordered that the final present use value manual attached to this order is hereby adopted and approved for use in appraising use value property at its use value as of January the 1st, 2021. A notice of the adoptions of this order shall be published once a week for 4 successive weeks in a newspaper having general circulation in Swain County. The final schedule shall be available for public inspection at the office of the Tax Administrator, 101 Mitchell Street, Bryson City, North Carolina, this the 10th day of December 2020.
Okay, this is the second half of what you looked at when you read all of this stuff. Any questions? If not, then I will entertain a motion that we adopt the present use, the manual, value manual for Swain County General Appraisal for 2021.
I'll make that motion.
We have a motion on the floor,
Make a second, Mr. Chairman.
and we have a second on the floor. All of those in favor of approving this, please raise your right hand. Passed unanimously. Thank you, Madam Clerk.
Lucretia asked her about capacity at the hospital, and she said there was plenty of capacity at both hospitals for patients.
Both hospitals, which,
Yes, Swain and Harris.
Oh,
They
okay.
have capacity at both hospitals.
okay. How many persons can Swain hold?
I don't know that yet, because everything would be directed to Jackson Hospital, because Swain is not technically set up
Right.
for COVID patients. So it would just be an absolute overflow,
Then they would be, okay, they would be the overflow that comes back into Swain County.
if there was, yes, if they
Right.
did not get them transferred to other hospitals.
Okay, appreciate that. Thank you very much. Okay, moving to item 6 on the agenda. It looks like county manager's report to me.
I got a few things. First, the pavilion project, we have it bid out through the 18th of December, so we should be getting back proposals. There's been a lot of interest on the pavilion project at the event park. Set out several packages for bids, so I'll be bringing that back to you in January. The next one, I was just going to kind of, we talked about our grant policy, which you put in place the other day, and we do want to apply for a couple of grants. One is for the sanitation program, hopefully to help with their baler, or a new baler that we'd like to get, which is a pretty expensive item with the baler itself and the conveyor belt. It's $163,000, and so we'd like to get at least half of that paid for, hopefully through grant funding. So that's due in February. I'm gonna go ahead and put the paperwork in for that. Just want to make sure y'all are aware of what we're doing. And also during the process, we would, next year we'd put it in the budget, of course, the other half of it.
Mr. Chairman, Mr. King, 163,000, that's a lot higher than what we were told
Yeah,
before. About 90, I thought, was the high end.
90 was just the baler.
Just the baler.
But since then, Scotty has wanted to add the conveyor belt because it's been giving us issues as well. So the conveyor belt is the other $60,000.
The convey, what was tore up, they was both tore up before, weren't they?
Yeah, I mean, we've had issues with them. Like I said, we bought that from Webster Enterprises. I think it was, gosh, a long time ago, like in 1991. It was 30 years old when we bought it. So we've kind of been band-aiding it ever since we bought it. And so to get it rebuilt, I think it was like $60,000 to get it rebuilt. But you're going to get a rebuilt, basically 40-year-old, 50-year-old piece of equipment at this point. So he thought it best to just get a new one. And I agree. If we can make the conveyor belt work, if we can continue with that and just get the baler, we'll also look at that. It's just the worst case scenario is 163, and if we are going to try to get a grant, we might want to get it all instead of just asking for part of a baler. So you get a little bit more bang for the buck. Okay. The other part, I've been talking a lot about broadband, and Danny will possibly talk about this as well. Looking at initiatives that can help speed up the process of getting more providers in the area, hopefully building up the current providers to let them be more, get more business, thus helping our students and their families that do not have adequate internet access, and looking at hopefully helping with barriers that families are hesitant to get internet because of barriers, which is either the initial setup fee or the monthly fee, that sort of thing. So the school system does have an initiative going on with Starlink, which is a new provider in a beta testing situation with the school system through a pilot project, and they were identified in the Swain, or in the west, and then there's one down east also. So two counties in the state got approved for this. So they are putting that toward an initiative. Through that conversation, though, we had some other dialogue about what other barriers is happening, and one of the conversations come out about hopefully getting some grant match dollars, or possibly even some programming dollars for the broadband committee or the new nonprofit that's been created. And so through the process of COVID, there is certain monies available, that we attained between March and now. We do have it where we can use it toward broadband accessibility. And so what I wanted to just get you to think about between now and January is if we could put $50,000 toward a project budget. Either we can give it to the school, or we can give it to the broadband committee nonprofit, and then let them handle the execution of the contracts, because we can't really get involved, but we can help fund a nonprofit and let them kind of go with it. So just be thinking of that. I thought it would be a good at least process. We do have those funds that we can use, and we did. I have already supplanted those back in last year's budget, so there's monies available that we can allocate for COVID-related expenses, and that would definitely be one. With all this transition and trying to get, kids to have accessibility to good, reliable internet, I think it's just going to propel us through the next phase of this with internet access in the community. So anyway, just be thinking about that, and we can have more of a discussion next month. Or if you have particular questions, let me know. That's just some of the dialogue we've been having. Not knowing really what provider we would want to go with. We did have some dialogue about if we wanted to do more with the new beta testing, but basically beta testing is testing to see if it's gonna work or not. So I don't know if you wanna put all your eggs in a beta testing site. You may want to do something different. So we really heavily relied upon the broadband committee, and they worked with that last week, I think it was last week, to try to decipher if we should look at doing that or something different. So anyway, just a thought. I wanted to just bring that out and get y'all to be thinking about it between now and next month. And the only thing I've got tonight is we've got 4 departments that are going to be on a limited type of, I guess, operational because of COVID. We've got, I know I've got 3 departments that have positive cases in them, and a couple more that are first contacts. So I can tell you right now that the tag office will be closed until after Christmas. The mapping office will be at least closed till Monday. Of course, I think the tax office has gotten through their stuff, but they have been limited staff in quite a while, and so they're doing by appointment only, probably till after Christmas. And of course, other places, the sheriff's office has been impacted. So anyway, we're sifting through a lot of different stuff with this. Just wanted to let you know there are going to be some operational hourly changes, and some departments will be closed because of it. So anyway, just want to let you know about that. And that's all I've got tonight.
Well, that was a good report. Danny, would you give us your?
We had a Zoom meeting with the Drug Coalition, and met their meeting. It went well. There's a lot of just kind of starting up another quarter with that, and getting the committees together and everything on it. So we did have that last week, and I think about everybody there was in the meeting, most all. Broadband will meet next week, I believe. Again, we have had a meeting, as Kevin was talking about. They're trying to figure out how they can best help to bring broadband. We're working with a lot of different providers, encouraging providers. It's an interesting business. Several of the providers around recently at an auction for, and some of this is a little technical, is above me, for frequencies, went out and purchased frequencies for this county, but some of them are providers that aren't doing anything in this county. So it's kind of a strange business, why they would spend a lot of money and then with no return for it. So, but they're looking at a lot of different things, and are willing to work with any provider that'll work with us. And that's like part of what Kevin was saying. There's still such a big discrepancy of households in this county that can't receive for one reason or another. Some of it may be, we've done a lot of surveys, and there's been a lot of surveys out. And some people may be a little reluctant to put down on that survey that they can't afford broadband, for their children. So it's hard to determine a lot of that through that survey. Working close with the school system, trying to figure some of that out, that beta program that Kevin's talking about is going to be, it's a satellite system that county in the west respect and one down east for this trial program. And what they have to do with that program is pick out 30 homes that are within a 10-mile radius that they could serve with that through that trial period, So there's a lot going on.
Does that look promising as you say that, or
well,
is it just?
It's still, the technology's still up in the air. The guy that owns Tesla, whatever his name is, he says he's going to provide broadband to the world through that process, but that's got a long way to go, a long way to be proved.
Yeah.
Nobody knows what the cost is going to be for one thing. People may not be able to afford it. It is a probably a more reliable setup than wireless or what we're having. The ultimate goal would be fiber to the home, but as we've all discussed, I think that's just not gonna happen.
Cost
anytime
prohibitive.
soon. Yeah. So it's, that satellite deal is still yet to be seen. I think that's part of why they're trying and doing these programs to see how they can do with it, especially in remote areas.
I think the first 6 months with that particular program, I think they're only gonna get like 4 hours a day.
It's gonna be
Or
limited.
8 hours a day.
Yeah.
It's, what they're doing is putting satellites, it's not like a traditional satellite like HughesNet where it's at a specific point out in space. These are low orbiting satellites, so they're moving faster than the rotation of the Earth. And so it's kind of like Google, what Google was wanting to do with their planes and things a few years ago.
Right.
It's the same concept. They're going to be moving faster, so they got to have a lot more satellites. And for the first 6 months, like I say, there's not going to be enough satellites to cover it, all the way around. So.
Is it possible, and has the committee looked at, Section A being students, Section B being households? I mean, we've got people in the county who really need that for business as well as other things. So are all of these close enough together that if they do one thing, decide to do one thing, they can hit the students as well as the people? Or the money's following the children, the money's following?
That right now is basically going to school system. That technology is just to see, and I'm not giving, I think it's just a probe to see if it's gonna really
Sure.
work.
Sure, yeah.
I don't know, they could have targeted anything, but that was a better program for them to target, I believe, to see if it works. Yeah, we're looking, like for instance, right now, we're working hard to try to get broadband out to some of the businesses out in the gorge.
Right.
It's just so much of our area is so isolated, it's hard to reach. The problem with out in the gorge, the fiber runs along the railroad, but it won't go to the businesses. Crossing the river's an issue. We're looking at maybe possibly running some fiber aerial across and get it on the other side of the river. Leonard's got a lot of good ideas and is in communication with a lot of different people on it. And they are continuing to work with providers on applying for grants, any provider that'll work with us. James has, received a couple of grants, but the problem with that, he's got a lot of work to do to follow up on those grants. So I think it's a little difficult to just continue to go out and solicit new business, because he's got a pretty good backlog of what he's got to catch. It's just, right now, it's seemingly, again, I still get things in the mail from Zito Media that says, all this fantastic broadband that they offer at these low prices, but they're not going out and pushing broadband. They're mailing flyers out. Frontier's not going out and doing it, nobody's really out there seems to be willing to go out and to push it. Except, like I say, in our area, to me, the only one that's really doing anything is James Skyway. Baltimore West did buy some of those frequencies. I'm not sure if they were for Swain County, so we're hoping that'll maybe get them motivated a little bit more. It's frustrating as roads and everything else, but there is being money put into it right now on a smaller level. The big money, the big grants go to the large, companies like Verizon and all those. And that money's not going to come here, I don't think. Those larger cities.
And it's hard to compete against that when you've got other people hiring on to do other things where the money is almost already guaranteed. Okay. Is that it? Okay, thank you very much. We need to do something with that.
I'm good this week. No report.
Okay, no report on this side, okay. Do you have anything?
Couple things, Mr. Chairman. Since we've had a couple of meetings, but not the regular session type meetings, but back in November 23rd, I had a Southwest Commission meeting. That was a Zoom meeting. And then on the first of this month, at 5 o'clock, I have a board meeting done online as well. And Tuesday, went to Andrews on 11 o'clock, had a Foursquare executive board meeting. And yesterday I attended the TDA. So that's the meetings I've attended, or doing a little bit of that extra. Of course, we've had a couple of meetings since our last meeting, special meeting, hearing meeting. Then I'd like to take the opportunity just to, right now, to thank the voters and say that it's an honor and a privilege to be reelected to serve as a commissioner. And I hope and pray and pledge to do the best I can. And one of the things I always try to do is make myself available and accessible to everybody. I always try to answer phone calls, text, emails, whatever way that they contact me. So I'd just like to pledge do my best, and again thank everybody. And it certainly is an honor and a privilege to serve. That's all I have, Mr. Chairman.
Good, very good, thank you. Thank you.
I attended the erosion control review committee meeting. It was, Bill Maher brought a few of his issues, what he wanted to look at. They're having another meeting January the 12th, 5 o'clock here. I think they're going to start looking at, last meeting was about if they had any issues or anything they wanted to bring up. Bill brought his, we talked more with Mr. Davis, talked more, but anybody else that has any concerns, if they want to send them with me, I can tell them and show them. They're going to start going through it line by line, I think, at the next meeting. Try to start structuring it, or going through and seeing what can be taken out, what has to stay. But it was very interesting. I'd also like to take this little bit of time and thank the voters for voting me back in. I appreciate it, and I just hope I can do a decent job.
You do a decent job, and I want to thank both of you for the willingness to come back and continue to work on some of the issues that we have in front of us, because some of them are pretty broad, as the broadband is, and some of them need to be done for the benefit of the public, as is the erosion control and all of those. We just need to get back in and look at them and get them going. So I appreciate everybody who is here. I appreciate all of you, because you bring your own expertise and things to the table, and we need that. So even if you don't think that you're adding because we have to hear everything that the people around us want. And which gives me, I was just looking for a page that I thought I had. The Swain Clean is having their last event of the year on this Saturday. And so that will be their last for the year. But I cannot tell you how great it is. I remember when I first came back to Swain County, the roads and the highways and the byways were just littered. And they've been doing an excellent job of keeping the county clean and keeping the county as pristine as they can. And I'm really, really proud of them for doing that. We have work ahead of us, as you well know, and I'm not saying anything you don't know. So I thank you very much for the efforts that you've put in 2020, and look forward to equal amounts of effort in 2021. And you and your staff, Mr. Manager, we want to thank them as well. And I think it's good, and we're walking forward, even with COVID on our minds and on our agenda and everywhere else, and we're very, very proud. And I'm proud of Swain County because we don't have as many active cases as we could have. And I think it's very great. I think people are taking care of themselves and taking care of their loved ones, and I think and hope that they continue to do so. So I'm very proud of that. Along with each of you, and I'm going to start with Danny, and I'm going to say, Danny, just say happy holidays and happy new year to the public. So if you would do that, please, however you want to say it.
Yeah, wish everyone a very Merry Christmas and a Happy New Year.
Good, very good.
I'd like to wish everyone a very Merry Christmas and Happy New Year also, and just our thoughts and prayers are with everybody throughout this holiday season.
Very good, very good.
I would say Merry Christmas to everybody.
Great.
Merry Christmas, Happy New Year's to everybody in our community and our county. And I hope everybody has a happy, healthy holiday.
You mentioned something a moment ago, and I think that anyone can find any phone number for either any of us that they want to talk to us. And so I'm proud of that and glad of that, and we hope that you all have a very safe Merry Christmas, and we're looking forward to another year of working together, and you, the public, is our eyes and ears, and if they don't bring anything that they're concerns to us, then we don't know about those concerns. So it's very important that they do that. Mr. Manager, want to wish everyone a Merry Christmas.
Yes. Hope you have a wonderful Christmas and a Happy New Year. Look forward to 2021.
Well, we do too. Fingers crossed. Okay. Thank you very much. Okay, now any new business, Mr. Manager?
I don't have any.
Okay, anybody got any new business they want to bring up at this point? Okay, we have no reason to go into a closed session this time. There you are. You want to say anything? Merry Christmas, anything? Okay, we got a Merry Christmas from the clerk to the board, so. Having nothing else on my agenda or the agenda, I'll entertain a motion for adjournment.
Make a motion, we adjourn.
Okay, got a motion, got a second. All those in favor, please say aye.
Aye.
We are adjourned. Thank you, gentlemen, very much. Very good.